A day in the life of an ER physician is unlike any other profession. The daily clinical aspects are repetitive. These consist of treating and discharging the patient, consulting with various specialists, and admitting patients into the hospital. A typical day is atypical. No 2 days are ever the same. No 2 hours are ever the same. You never know what you're going to see when you start your shift in the ER. The ER is high stress. With the responsibility of working in the emergency room comes intense, unpredictable cases, long hours, and many stressful situations. The income is extremely good. One can find an entry-level position at $250,000. A normally scheduled ER doc's salary is in the $300,000 range, and that increases the more shifts one picks up. Lastly, the ER is not for everyone. With this career, one must learn to find a balance among stress, income, and time. Many people don't agree with the lifestyle, the long hours, and the high stress. It definitely takes a certain type of individual for the intensity of the job. As you can see, an ER physician has a ton of different responsibilities. Overall, emergency medical docs must think and act quickly to treat patients with life-threatening conditions, work on a team that consists of other healthcare professionals, and evaluate a wide variety of ailments, usually with a limited amount of information. The work environment is rarely quiet, normally with multiple traumas coming in at once. ER physicians also get to use high-tech medical equipment to treat their patients as effectively as possible. While it does sound really exciting to be an ER physician, that excitement can be positive or negative. Feeling a rush of adrenaline each time you save a critical patient is very rewarding, but on the flip side, there are serious hazards to be aware of. When patients are brought into the ER, you as a physician are unaware of their situation until information is given to you. In some cases, a patient can be violent and bring harm to you, your team of professionals, or other patients. The ER is probably the least sterile department in the hospital because patients are brought in pretty randomly. This increases your risk of infectious disease exposure, which can endanger you as the physician. And because of long, stressful hours in the ER, physicians have a higher rate of burnout and an increased risk of coronary artery disease and impaired reproductive health.
An emergency room physician, the largest employers are hospitals. In order to find work in this field, emergency room physicians typically, but not exclusively, practice in a hospital-based setting. This is to ensure the efficient and reliable staffing of the emergency department of the hospital. The average starting salary for an emergency room physician before completing their residency is $166,000. The median annual salary increases to $187,000. Long-term outlook for this career is great. In fact, it has a projected 10-year growth of 14%.
Emergency physicians are not required to join a union, and there are no mandatory professional associations that an emergency physician is required to join in order to practice emergency medicine. However, to practice in most hospitals, you must achieve board certification. Some related occupations are emergency medical technicians and paramedics, who are also skilled in emergency medicine and provide life-saving care to patients at an accident site and to and from the ER, as well as emergency room nurses who also work in the same settings as emergency physicians, providing urgent care to patients. The gender distribution of the profession is highly skewed towards men, with women making up only approximately 25% of all practicing emergency physicians. Dr. Edwin Leap describes on his blog the difficulty and intensity of working as an emergency room physician, writing that until you've come to work a shift alone with a full waiting room and 10 potentially critical patients right up front, you don't understand what it's like on the ground. In fact, emergency department physicians do the work of several people throughout their shifts, from secretary to social worker, from surgeon to psychologist, pediatrician to hospice worker. Dr. Joshua Harris, another emergency physician, said during an interview about his career that a love of people and a love of science brought him into emergency medicine, and that only about a third of his time is spent face-to-face with patients. He also mentions it takes an enormous amount of physical and mental energy to make it through a full day, meaning that this profession is not for everyone.
The education requirement for ER physicians is quite similar to a general physician. After earning a bachelor's degree in any major and completing prerequisites in math and science, you can then enroll in medical school to earn a MD or DO. Then residency is required for 2 to 6 years, and for ER physicians, residency is most important as physicians gain a hands-on experience and skill that is vital for dealing with the variety of trauma an ER doctor will see. After residency comes licensing. A medical student must pass the U.S. medical licensing exam before they can gain their license. Furthermore, skills needed for this career is the ability to learn to respond to a variety of medical issues and be able to stabilize a patient for further treatment. But before all that, you need to ensure that you get into a medical school that is right for you. Things to consider is location, tuition, and job availability after medical school. Jobs in rural areas compared to city are vastly different when looking at workload and pay. Additionally, the turnover rate for this career is pretty low and is at about 7%. As a whole, healthcare-related careers have a low turnover rate, but ER physicians have a turnover rate of about 7%, mainly because of the fast-paced and stressful work environment and increasing patient volume. However, ER physicians is a great but rigorous career choice. If you thrive in a fast-paced environment where people's lives depend on your care, then this might be the career for you.